Hello everyone. Here's a quick guide to help you with exam one. I'll start with the theories. A few tips to help you in the theories would be number one. Pay attention to the scenario. The big thing is for you to be able to apply what you have learned to the question that you're being asked. So let's take Freud, for example. Freud addressed the concept of id, ego, and superego. I'll give you an example. If I tell you about a family that goes to the store, for example, and their 4-year-old starts to throw a tantrum because they cannot have their way, that is the id at play. Id is that part of us that wants instant gratification. It's about me. They feel the world is centered around them. Okay, that's the id. Now, if I talk to you about superego and give you a scenario where somebody has to make a judgment, let's say, for example, they see somebody's money laying around and they think there's nobody there to catch them. So they would look at the money and say, well, because of the values I have, because of my moral upbringing, I will not take the money. So that's the super ego at play. Okay. So super ego is about our morals and our values. Let's talk about Maslow. Maslow's hierarchy of needs. If you see a scenario that is describing a patient that has, let's say you walk into a room and the patient has urine all over them, and the question is asking you what will be your priority action, what will be the first thing you will do for this patient according to Maslow's hierarchy of need. What will be the level of need that you're going to address? What this question is trying to ask you is, what will be the first thing you will do? And that means you're going to clean your patient up, right? That will be the first thing. When you walk into the room, the patient has pee all over them. What you do is, oh, let me take you to the bathroom and clean you up, or let me change your briefs. So, according to Maslow's hierarchy of need, your priority nursing care will be the basic one, which is physiological need, also called physical needs. Now, the same scenario, if you see a patient that is about to jump off a cliff, or let's say the same patient that has pee on them, they're about to fall off their chair or fall and hurt themselves, your priority need, according to Maslow's, will be safety needs. Okay, so look at your scenario. That will help you pick your answers. Okay, let us talk about Erikson. Erikson's stages of development. I encourage that you learn the stages, the way he outlined it in the text. The questions will be created in such a way the scenario will point to the stage of development. If I ask you about a 29-year-old, you're looking at the stage of development that 29-year-old person falls in. Furthermore, you look at the scenario. Am I asking you if this person has met these needs or not? Or am I asking you if they're supposed to be there or not? Just pay attention to the question and figure out what you're being asked. One of the examples I like to give is if I say there is a teenage or an adolescent young boy that has he has a deep voice. He's at the age of puberty, and what task, according to Erikson, is this individual trying to accomplish. If I give you options like abstract thinking, or trying to have a girlfriend, or let's say beginning to differentiate themselves from their parents. Now, Erikson talked about psychosocial development, right? Erikson did not talk about sexuality. Erikson did not talk about abstract reasoning. Erikson identified stages in a human being from age 0 to old age, and identified some tasks that they're supposed to accomplish at different stages. Excuse me. Sorry. So for a child that is around the age of puberty, they're trying to differentiate themselves from their parents. That is when the children at that age, they don't want you to hug them and treat them like babies anymore. They want to differentiate themselves from their parents. Okay. Understanding the role of neurotransmitters as related to disorders, I encourage that you read that part. Dopamine, serotonin, norepinephrine. There's a table I referred to you too that you can look at and address that part of the concept, or address that part of the guide. A nurse-client relationship. Nurse-client relationship came out of the work of the mother of psychiatric nursing called Hildegard Peplau. The key thing in this exam is for you to understand there's a difference between nurse-client relationship and your relationship with your spouse, your relationship with your family, your relationship with your children. So we have to distinguish between a nurse-client relationship and our social relationships. Now, the phases of the nurse-client relationship has the pre-orientation phase, the orientation phase, the working phase, and the termination phase. I need that you understand what goes on in these phases. That's how the questions will be geared, and understanding what goes on will help you answer the questions. I'll give you an example. If I ask you to tell me what phase this is, the scenario I will create is happening. For example, if I tell you that the nurse and the patient, they're actively involved in a therapy session. Let's say patient is having cognitive behavioral therapy. That means that's a working phase. The scenario implies that there's action, there's something happening, something is being done. Giving medications, going for family therapy, going for any kind of therapy, anything that you're actively doing during the relationship, that patient is being managed, there is active management of the patient. That is the working phase of the nurse-client relationship. Look up the other parts. Excuse me, 1 second. Look up the other phases and identify what goes on in them. Okay, I'm trying to work from my laptop. I have let's see, so I can get this right. Okay, 1 second please. I'm going to take my face off the camera briefly. I'm actually using my laptop as a guide here, so give me 1 second, okay? All right. Um, the role of the psych RN versus that of advanced practice nurse, what we're trying to actually find out from you is the scope of practice. The advanced practice nurse, they can write prescriptions, they can do therapies, but the scope of the registered nurse is not up to that. The registered nurse can, give patient education. Okay, you can carry out doctor's orders, but you're limited to what you do. So that part of the guide is actually asking you to differentiate and identify what an advanced nurse practice nurse will do versus a registered nurse. Okay. The nursing process. Excuse me. Most of you are familiar with the nursing process. I would say all of you. In fundamentals, I believe you use the nursing process to conduct your care plan. Now, know the steps of the nursing process. Okay. It is standard. You start with well, I don't have to tell you what the nursing process is. Just go ahead, look it up in your books and know the steps. Now, if there's a tweak, be careful. Things to note: number one, a nursing diagnosis is not a medical diagnosis. Okay, so if you see something like a medical diagnosis there, that's not the right one. The other thing is that in the nursing process, you plan before you implement, right? So planning must come before implementation. Also, the concept of outcome, you're looking at outcome in terms of goals. Okay, so outcome falls within goals. Okay, now remember also with goals, your goal has to there must be a time frame, very important in a goal. It must be it must be realistic and it must be attainable. Okay. Okay, let's go up again. Where are we? Let's see. All right. Also, what's the next one? I think I'm going. All right. Interviewing the psychiatric client. I said describe the sections of the MSE. That is also self-explanatory. Look that up in your texts. That's really easy to look at. Okay. Communication. Nurses are supposed to be empathetic, not sympathetic. Now, empathy means that you can understand where the patient's viewpoint. You can put yourself in the patient's position. Okay. Now, therapeutic communication, non-therapeutic communication. You have a table in your text. I encourage that you go over this table. The concept of therapeutic and non-therapeutic communication resonates through this whole course. You cannot run away from it. So after this exam, you're going to see it in all the other exams, because every disease process we treat in mental health, therapeutic communication factors in. In fact, in our entire nursing career, you're going to have to address therapeutic communication all the way. Now, a couple of things I want to tell you about therapeutic communication. You don't ask a patient why it puts them on the defense. Please, if you see any response that is talking about why, don't ask a patient why. Do not give a patient advice because it takes away autonomy. The ultimate choice remains the patient, and you cannot take that away. So your responsibility is to lay the facts. If a patient, for example, has a diagnosis of cancer, end stage, the situation does not look good, it is not for you to advise the patient what to do. Your responsibility is to lay the facts, and the patient ultimately makes the choice. So you do not give advice. The other thing is that you don't put the patient on the defense. Okay? You look at a question or a scenario. If it's asking you about therapeutic communication, look at the responses. Are they clarifying? Are they validating? Are they summarizing? Okay, those are the things that point to therapeutic communication. Non-therapeutic communication, I have told you about them. Don't ask anybody why. Okay, and don't give advice. There are other things to non-therapeutic communication. I encourage that you look at the text, look at your tables, and you'll be able to figure them out. Cultural consideration. What I'm looking for here is for you to incorporate culture to nursing care. Okay, you want to understand how diverse culture is, ranging from religion to sexuality to values to, it's just broad, but understand culture in the context of managing your patient. Ethics. Ethical dilemmas, we come across them every day in our career. Now, as nurses, we need to pay attention to them so that we are not breaking those ethics or we're going against the ethics. Negligence, autonomy, justice, beneficence. Negligence, a good example. If, let's say, for example, you have a mental health client that told you that, this doctor, I don't like what he's done, how he behaves, so I'm going to get him, I'm going to get him. And then you do not tell the doctor anything. The next day, you get a report or that the doctor was beaten up by the patient in the parking lot and they're now hospitalized. Now you have neglected in your responsibility to watch out for a professional colleague. From a co-worker, the doctor. You did not warn them. You did not tell them that this is going to happen. Okay, so that is negligence. Autonomy. Like I said earlier, autonomy is about allowing the patient make their own choice. So a question that points to letting, or a response that points to letting the patient make their own choice is autonomy. Okay, so read up the other ethical concepts and find out, or within you try and come up with examples to explain them. Okay, let's see. All right, one that one of the ethical dilemmas that students get confused about is that of justice. Now, between justice and fidelity, I need that you look at them closely and be able to understand the subtle differences. All right, let's look at quickly at antipsychotics. I think I just jumped something, but that's okay. I'll come back to it. Antipsychotics, I want you to pay attention to the typical conventional first generation. Know the different medications, okay? Atypical / second generation. Atypical antipsychotics. One thing is they have the side effects of agranulocytosis. Now, there's so many things that happen with every medication, but specifically with this antipsychotics, agranulocytosis is huge, and this simply means that the patient has low WBC. Now, low WBC is very dangerous. That means the patient's immunity is low. Okay, they can easily catch infections. So, if you have a patient on antipsychotic and you walk into their room, take their body temperature, and they have a fever, think agranulocytosis. If you go into the room, the patient is tired, the patient is weak, signs of malaise, that means they might have fever. Or they present with flu-like symptoms, that is pointing you to agranulocytosis. So I can ask you a question about this medication. I don't have to mention agranulocytosis, but the symptoms that you see speaks to what I'm talking about. So if I say that patient is on blah 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 antipsychotic medication, what are you watching out for? Okay, so if I say fever, yes, you're going to watch out for fever because that is a sign of possible agranulocytosis. And that would be the good answer, the correct answer. Or if I tell you the temperature is 101, that is fever. If I tell you the patient is weak, that is like symptoms of somebody that has low immunity, pointing to agranulocytosis. I can tell you the lab work shows that the WBC is very, very low. All right, so I can go around all this, but the point is a fatal side effect of atypical antipsychotic is agranulocytosis. Okay, so read up your medications, know the side effects, and that's how the questions will come. All right, let's anxiolytics, I believe that's how it's called. Anyway, these are anti-anxiety medications, simply put. Your benzoids, pay attention. A lot of psychiatric patients are on benzoids. Identify medications in the class, things like lorazepam, things like buspirone. Okay, common side effects. Lorazepam, which is the same thing as Ativan, versus Buspirone. Ativan is addicting. Okay, that is the big thing. Buspirone, less addictive. Okay. Let me see what else we have here. Sorry, doing a very nice tip here. Okay, let's see what else I'm missing. Antidepressants. Please pay attention to your antidepressants. The whole, there's a lot of drugs there. Your SSRI, your monoamine oxidase inhibitors, recognizing signs and symptoms of serotonin syndrome. The big thing I want you to pay attention to, please differentiate them. I would get like a card or like a cardex and write out SSRIs, tricyclics, monoamine oxidase inhibitors, okay, so that I can know the difference. Monoamine oxidase inhibitors, I know we talked about, or you guys read about it having something to do with tyramine. Now, you might not see tyramine in the whole thing. You might see things like bacon, okay, aged cheese. So not only do you know what tyramine contains, what is in tyramine, and examples. Okay. The other thing with this monoamine oxidase inhibitors, and one question that I like to throw out there is you giving patient education to your patient on monoamine oxidase inhibitors. And the question says, what will tell you that the patient understands your nursing education? I mean, your patient education. And one of the answer or the right response will be that the patient will tell you that they will talk to their pharmacist or their physician before they take over-the-counter medications. That is the correct answer. You know why? Now, your over-the-counter medications, they contain some tyramine agents. They contain vasopressin. Vasopressin is like a vasoconstrictor. Now, if you take over-the-counter medications such as cold medicines that have pseudoephedrine in them, they have vasoconstricting agents that will cause your blood pressure to be high. Most monoamine oxidase inhibitors have a side effect of elevated blood pressure. So when you take this cold medicine plus your monoamine oxidase inhibitors, there's a chance you go into what we call malignant, hypertensive crisis. That means your blood pressure, goes really high. But my thing is, pay attention to these side effects. Understand salient points in them. Okay, recognize serotonin syndrome and signs and symptoms. You might get a straight short question from that tells you to just for you to be able to identify the symptoms. All right, this is all I have for you. If you have any questions or you're struggling with understanding some concepts, please feel free to send me a text message 813-505-2902. I also encourage that you go over questions and answers that all the topics that we have treated so far. Go over the questions and answers, look at the rationales, whatever book you're using. The important thing is to understand why the right answers are right, and while the wrong answers are wrong. All right, this is it for now. I have to go, and I'll see some of you on Tuesday. Good luck. Bye.